This patient has a complete ACL tear and medial meniscus posterior horn tear. So today we are going to do arthroscopic ACL reconstruction and meniscus repair. So as you can see, I am seeing through the anterolateral portal and I have inserted the arthroscopic punch from the anteromedial portal. I am debriding the torn remnants of the ACL, and this is the ACL stump that you are seeing. In the back you can see the PCL on the right side, and now I am using arthroscopic shaver to debride the ACL tibial stump. So this is the picture of the intercondylar notch, and now we go in the medial compartment, and this is the posterior horn of the medial meniscus tear. As you can see, I am inserting my probe from the anteromedial portal. I am seeing through the anterolateral portal, and I am pulling the torn portion of the medial meniscus posterior horn with the help of my arthroscopic probe. So this is the tear. It is very important to identify the tear completely in order to plan for its repair properly. So this is what we are going to repair. This is a young individual, so we want to preserve as much of the meniscus as possible. And this is tear involving the red zone, so definitely we are going to repair it, and it is going to have good healing potential. So I'm going to use all inside device for this repair. So as you can see, I'm going to insert my half cannula through the anteromedial portal, through which I'm going to insert the all inside device in the medial compartment of the knee. And I'm going to take my first bite through the substance of the posterior horn of the medial meniscus. I have done MCL pie crusting for the view that you are seeing because it was quite tight before. So we need to do MCL pie crusting for us to have better view of the medial compartment. Otherwise there will be inadvertent cartilage injury because of our procedure. So I have deployed first implant through the posterior horn of the medial meniscus. So as you can see, I have gradually removed the needle, and now I am going to pass the device through just 1 centimeter away from the first bite, and this is going to create horizontal mattress configuration of the suture. Knot is tightened and the suture thread is cut, so this completes our first implant deployment, and this has created slightly eversion of the posterior horn of the medial meniscus, which I am going to correct by inserting another all inside device through the inferior surface of the medial meniscus. So the first implant has been deployed, and now I am going to pierce the posterior capsule inferiorly to complete vertical mattress suture configuration. And now I'm going to pull the thread to tighten the knot, and then I'm going to cut the thread with knot cutter. One more device is required to complete the repair. So as you can see, I have changed my portal. I am now seeing through the anteromedial portal, and I have inserted the all inside meniscus repair device through the anterolateral portal, and I have taken one bite from the substance of the medial meniscus, and then I'm going to take another bite around 1 centimeter away from the first bite, and then I'm going to deploy the second implant. As you can see, I am finding a bit difficult to navigate the tibial spine, which is usual in this part of the meniscus. So as you can see, I have completed the deployment of both implants from the third device, and I have tightened the knot and I am going to cut the thread. So this completes our arthroscopic medial meniscus repair procedure. This is the picture of the whole meniscus after it has been repaired. It is quite robust and strong repair, and we are hoping that this is going to heal quite well. Now we shift our focus towards arthroscopic ACL reconstruction. So as you can see, I am going to insert an owl to identify my footprint, and once I have confirmed my femoral ACL footprint, I am going to drill the guide wire through the hole that I have created with the help of microfracture owl. The guide wire is drilled, and on top of the guide wire I have inserted endoverton drill bit to drill the tunnel through the lateral femoral condyle. The length of our tunnel is 38 millimeter. Now I'm going to insert guide wire and I'm going to drill with 8 millimeter drill bit over the guide wire till the mark of 20 millimeter, because that is the length of the graft that we intend to keep in the femur, and we are going to use adjustable loop and overturn. So this completes the femoral tunnel preparation. Now I'm going to drill the guide wire through the tibia to create a tibial ACL tunnel, and as you can see, I'm going to drill on the guide wire with 8 millimeter drill bit to complete the preparation of the tibial ACL tunnel. So now I'm going to pull my graft attached to the adjustable loop endo button from the tibial tunnel to the femoral tunnel, and then I'm going to flip the button when I reach the mark of 20 millimeter on the adjustable loop. So we have reached the mark of 20 millimeter. Now I'm going to flip the button, and once the button is flipped, I'm going to tighten the adjustable loop, which is going to pull the graft from the tibial tunnel to the femoral tunnel, and this is the graft coming through the tibial tunnel and going to the femoral tunnel. And once we do that, we are going to fix the graft at the tibial end with interference screw. So this is the post operative x-ray. Thank you.